Good morning and welcome to Health Professional Radio. I'm your host, Neil Howard. In this segment, we're going to be having a conversation with Dr. Andrew Krivoshik. He's Senior Vice President and Oncology Therapeutic Area Head at Astellas Pharma. And he's joining us to talk about some findings from the Phase 3 PROSPER trial in men with non-metastatic castration-resistant prostate cancer. Welcome to the program, Dr. Andrew Krivoshik.
Oh, my pleasure, Neil.
Give us a bit of your role there at Astellas Pharma.
Sure. Our group oversees the clinical development of our oncology pipeline. So we generate the data that then is used across the portfolio, both for regulatory submissions, but also, more importantly, to demonstrate the value to patients for the medicines that we're trying to bring forward from our diverse pipeline. Mm-hmm. We oversee a broad pipeline of which include a number of late-stage assets, such as the Xtandi, which the PROSPER data read out at the final survival data at the most recent ASCO, as well as with other late-stage agents such as Zospada, which also reported some later mature data in survival at this most recent ASCO as well, and then a number of other agents, enfortumab vedotin, which was recently approved, but then a whole variety of early pipeline agents looking, again, to try and address really difficult to treat tumors in indications that there's very high unmet need for patients.
When it comes to cancer in general, survivability is a key when it comes to choosing a treatment plan, correct? And quality of life during that survival, yeah?
So one of the keys, as you highlighted, is survival, but it's also the quality of that survival. Mm-hmm. And with the PROSPER data that was simultaneously reported at ASCO in the New England Journal of Medicine, enzalutamide, or Xtandi, has now been shown to extend survival for men living with castration-resistant prostate cancer, even if the disease has not yet metastasized. So although survival is very important, where you sit on the disease continuum for prostate cancer also will sort of adjust, if you will, your considerations for the benefit risks of the different interventions that are available. So you're exactly right. Survival is a key critical endpoint that is very meaningful for the number of patients that unfortunately have prostate cancer.
Well, let's talk about the meaningfulness of these findings. Now, non-metastatic castration-resistant prostate cancer. To some, that may be self-explanatory, but explain to us exactly what that type of prostate cancer is and why this study and these findings are so meaningful to that particular community.
Absolutely. If you think about prostate cancer as a continuum of a disease, and you think about an agent such as enzalutamide, Xtandi, and the data that we've brought forth in terms of demonstrating the impact for patients in the very advanced stages, so what's considered historically post-chemotherapy, post-castration-resistant, and then earlier in the disease continuum, before chemotherapy. Usually in that setting, it's highly metastasized and the survival is much shorter. When you think about and that was the data that was previously presented with AFFIRM and PREVAIL. If you go earlier in the disease continuum, which PROSPER is one of the key clinical trials in the non-metastatic setting. So in those AFFIRM and PREVAIL, there were a very advanced disease, pre or post chemotherapy, and a fair degree of metastases and high disease burden. Earlier in the disease continuum, the question always is, how large of a magnitude of effect is there for an agent such as enzalutamide? The concern is in terms of when you're treating a patient to sort of balance the overall benefit risk and try and figure out, do you intervene early or you intervene later? And the data from the PROSPER trial in particular, and I'll point your listeners to the New England Journal of Medicine article that was simultaneously published with the data at ASCO, really highlights that earlier in that disease continuum, so even before metastases have been established, that patients who have castration-resistant prostate cancer, so that a more advanced form of prostate cancer, there is a substantial and significant survival benefit for intervening with enzalutamide on top of the backbone of androgen deprivation therapy.
It has not metastasized. Is it going to metastasize at all or significantly slower as the disease progresses? How does it actually work in the body?
So in terms of the natural history for prostate cancer, if a lot of times there's diagnosis at the time of metastases or where the cancer is not yet metastasized. And there are a number of other additional trials we're looking at, and we actually reported out in that earlier space where you maybe still have castration-sensitive population. That's the ARCHES trial and the ENZAMET, which was conducted by ANZA, a cooperative group based out of New Zealand and Australia with our collaboration partners, Pfizer, highlights that even in that earlier disease continuum, if you have an intervention with enzalutamide, there's benefit for patients. Now, the question about metastases is the natural history for most patients, unfortunately, is as their disease progresses, the metastatic burden increases. So if your prostate cancer has not metastasized at the time of diagnosis, unfortunately, there's a large percentage of patients that then will go on to metastasize. Mm-hmm. So not only if you intervene, do you increase that survival, but if you think about, and we have additional data from other ongoing trials that looks at the delay of time to metastases or the time to overall metastatic burden, the earlier one intervenes, particularly with an agent, also delays that progression of that natural history. But specifically the PROSPER data, why it's so meaningful right now is that in addition to the delay of the metastatic burden, it actually also conveys a survival benefit for patients who unfortunately have a castration-resistant prostate cancer.
Does age play a factor in the survival rate of this type of cancer with this type of treatment? So
age is always an interesting stratification factor that we look at because sometimes it's a proxy for comorbidities and also a proxy sometimes for overall disease burden. If you look at the aggregate data for enzalutamide, we actually have looked at is there a percentage of patients above a certain age that the benefit risk is different than those that are at a different or younger age. And what we see is across that age continuum, if you will, benefit for patients with obviously taking into account the potential for comorbid conditions such as cardiovascular disease or other things which actually associate higher rates with the older populations in general. So to answer your question, yes, across that disease age spectrum, taking into account the comorbid conditions, there also seems to be benefit across the age continuum.
You referred us to a New England Journal of Medicine article earlier in our conversation. Give us a website where our listeners can learn more.
Absolutely. The primary manuscript is now available at New England Journal of Medicine's website, which is www.NEJM.org. And there, not only the abstract, but the entire manuscript will be available.
Great. Appreciate it. Thank you so much for joining us here on Health Professional Radio this morning, Dr. Krivoshik.
Oh, my pleasure. You have a great day, Neil, and your listeners as well.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen and download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.